No improvement even after the second PRP session. Will it improve with more sessions or shall I stop? I had my second PRP session 3 weeks after my first session, but still my hair sheds at the same speed. I'm planning to take the third session 1 month after the second session. Shall I continue with the treatment?
Thank you for your question. You submitted your question without a photo, and you're stating that you've had your second PRP session and that you're scheduled for a third one after a month, and you feel that you still are shedding hair with the same rate as before your first treatment, and you're asking, should you go on further? Well, in light of this question without a photo and further medical history, I will just give you some guidance as to our experience in our practice with situations similar like yours for people who come to us. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers, a system we developed to help people with male and female pattern hair loss using PRP and acellular matrix. And this is a system we developed starting about 7 years ago, and people come to us from around the world. So your situation is pretty familiar to me. So first of all, I think it's important that you have had a proper consultation with the doctor who actually recommended this treatment plan. And the point of that being that your doctor's experience should be able to guide you as to what your expectations will be. You know, one of the things that I have observed when patients have come to us, and many have come who have had PRP done elsewhere. PRP, again, is platelet-rich plasma. It's derived from your own blood, and it's a concentration of wound healing and growth factors that, amongst the other many things, it can actually stimulate hair growth. The question is what is the long-term plan? And what I've seen is patients have come to us usually after they've gone for about 4 sessions of PRP, separated by about a month apart. And for me, it means that PRP is being done in a way that short-term may stimulate growth, but is to what end can you continue doing this, and what happens if you stop? And this is the question that always should be asked. Now, every doctor will bring their experience to the table, but what I'm hearing a lot from patients who are coming to us is a lot of doctors don't have a lot of experience, and they're offering it kind of half-heartedly with limited knowledge or limited understanding explanation, but know that, hey, they learned that PRP helps hair loss and now they're doing it. And the same thing applies to doctors who are offering PRP and ACell. So one of the things that's really important for you to understand is to first ask your doctor, what exactly is the game plan, and also why are you still having hair shedding? Now, I'll share with you our experience with a different approach, and this is a procedure called hair regeneration. The company I started, TrichoStem Hair Regeneration, evolved from that. About 7 or so years ago, we were doing hair transplants with the intention of helping those hair transplants heal better. That means improving the graft survival and improving the wound healing of the donor area. A very fortunate side effect was that thinning hair became thicker. And this became true months and months and months after the transplant. And this is important. What we did over the course of several years was develop a method of using PRP and acellular matrix and an algorithm to help men and women with hair loss, basically androgenetic alopecia, or male or female pattern hair loss. Now, we basically have a protocol currently where we treat at a single point, and then we watch our patients every 3 months, And depending on the type of person we're treating, we'll do another treatment around 15 months. Now, this protocol, as well as prior protocols, have essentially resulted in about 5-year longevity for the benefit of the treatment, which means the benefits being stopping progression, inducing the regrowth of hair that's not currently growing, inducing the shed of thinning hair so thicker hairs grow in, and basically overall improve the strength and quality of the hair. Now, this stem cell technology that acellular matrix is the basis for is basically the acellular matrix recruits your body's stem cells or adult stem cells to essentially, in a wound healing scenario, literally duplicate the tissue that it is being placed for. So for example, if it's placed on skin, it helps heal with skin, helps muscle heal with muscle, as opposed to scar tissue. Now the mechanism for the hair treatment remains not yet fully defined, but I suspect there's a lot of subcellular or cellular interactions and a lot of biochemical interactions that are resulting in a longevity that doesn't require constant injection. And that's a big deal. And, for patients who come to us from around the world, it's impractical for them to even consider coming to us every month. And this protocol and system we developed has worked out very, very well. Now, of course, I look at every patient as an individual, and I look at their relative situation. For example, with males, I look at their degree, the age of onset, the rate of progression, and what I suspect is a relative DHT sensitivity. With women as well, I look at all different variables. Every patient is still an individual, but this is our treatment that has worked out very, very well, and we do frequently see people who have gotten fatigued with going monthly for PRP treatment. Now, this does not mean that there is no benefit to PRP. We use PRP in our practice for a lot of things. We use it for acne scars, we use it for wrinkles, we use it for under-eye dark circles, we use it for skin texture improvement. We have helped a lot of people with PRP, and I think PRP is a remarkable technology, and it's being slowly recognized or reluctantly recognized by the dermatology community and other specialists. So I think that you need to ask this question to your doctor. When we see our patients, we follow our patients very closely. We take photos every 3 months. We review their results. We explain what is typically anticipated. We don't expect that one injection and suddenly everything gets significantly better immediately. There's actually a process in which the body responds to our treatment that we have been able to document and help people understand the trajectory and what to expect. And of course, close follow-up is extremely important. So I've presented to you some new, hopefully useful ideas to help guide you as to how to make your decision moving forward, but I can't emphasize enough a dialogue with your doctor about what's going on and what to anticipate moving forward. So I hope that was helpful. I wish you the best of luck, and thank you for your question.